Assalamu alaikum, and this is your very own Dr Shabina Asad Qayyum for Salam Radio 106.2 FM. As usual, it's an absolute delight to be back. Last week we had a fabulous program with the amazing Dr. Ghulam Saqib, where we spoke about Parkinsonism. And I've always found that there's a gap between my radio shows. And I know that it's bank holiday, and I hope that you've all had a delightful bank holiday. But this week I thought, no, I'm not just going to take the day off. I'd rather spend it with all of you. So it's great to be back. I hope that you're all doing very well. I hope that you've all enjoyed the glorious bank holiday weekend, doing things with your family, which is the most important aspect, I think, of our lives. And before I go on to talk about the topic of this week,
You're
I'm actually going to reflect a little bit
it's now
on
time for
the previous week's events that have taken place. And
this Azan is sponsored by Park Foods.
The
Come and see the
revelation
difference
of GCSE results. I know that many of you listening may have received your GCSE results. I just want to say what a wonderful So I think I've just been informed by the station manager that the Azan is playing. So we're going to come back in a few minutes so I can rattle on again. Assalamu alaikum and welcome back to your very own Dr. Shabina Asad Qayyum's Body, Health and Mind Show on Salam Radio 106.2 FM. So before the Azan break, and I do apologise that I was rattling through whilst understanding that the Azan had all of a sudden played, mustn't be caught out by that next time, is talking about the GCSE results that a lot of our youngsters have received over the last week. And I've received many disheartened young people who've received their results and have said that they felt very disappointed in the results or grades that they received. And I'm starting to do a couple of what I call motivational lived experience videos on the TikTok platform. And the reason why I do that is because I feel that it's incredibly important for young ones to understand that they are more than just a grade. The peer pressure that we get nowadays through grades is far, far too much. And it has an impact on young people's mental health. They carry that with them, doubting themselves throughout their lives as to whether they are good enough. And we certainly shouldn't be encouraging that type of seed to be planted within our youngsters. So if you are parents, or if you're a young one that is listening to this today, I want to say to you that if you've worked hard and you haven't got the results that you have, trust me, there are many, many options out there for you to flourish. And on the back of that, I just want to say that I give a shout out to every single young person within this city who's received their GCSE grades, whether they were good, whether they were bad, whether they were what you expected or what you didn't expect. You are absolute superstars. So today's Salam Radio Body Health and Mind Show is dedicated to you. Now, without further ado, let's get on with the show. And I thought that I would talk about something, I'm not going to say nice and easy, but something that affects people. Many people, in fact, not just young people, but it can also affect people who are adults as well. And that's going to be about acne. But in order for me to do so, I do need your cooperation. I do need you to communicate with me, talk to me, ask me any questions you like. But the only way you can do that is if I'm going to give you the details. So without further ado, you can ring me and talk to me on 01733 602133, or you can text on the WhatsApp number, which is 07411 191062. As well as that, you can comment on the live stream on Facebook, YouTube, Twitter, or Twitch. And I've got my first comment from Jason McNally. Hello, Jason. Welcome, and thank you very much. He says, always listening, Doc. And Jason always does support my shows. So you're an absolute hero, Jason. Thank you very much, and encouraging others to listen to as well. So, talking a little bit about acne. Acne are also what you call zits, spots, pimples. Very, very common, more so common in the younger generations, particularly in teenagers. And it can also occasionally affect middle-aged people and even babies, believe it or not. It often causes a lot of worry because of the cosmetic effects and distress. They can usually clear up. Treatment can take, on average, about a month to show any effects at all. And you continue to use it for a while, any treatment that you're given, even after the spots have cleared. But my job here is to tell you today that how we go about treating acne. And without further ado, we've also got Nabil Elahi's in the house here, always here to show the love. And I know that, Nabil. I don't doubt you for one single minute. You're an amazing individual doing some great things for our city in Peterborough. Great to have you on the show. And Kiran, hi, Salam. Thank you for providing English subtitles. You are very welcome, Kiran. And thank you for helping all of us with British Sign Language interpretation as well, because I follow your page quite avidly, and I think that you are a beacon of light and a beacon of hope to people who are hard of hearing within our city. So thank you very much, all three of you, for joining as well. Keep those comments coming in. This keeps me going. It's wonderful that we have great people like you do. Now, what is acne? Let's talk about it. Let's get down to the crunch about what is acne. It's a very common skin condition, and it usually causes white, black, or red spots. And they're usually on the face, but they can be on other parts of the body as well, such as on the back, on the chest, and also on the shoulders. And acne actually arises from these special glands on the skin that are known as sebaceous glands, and they're actually found near the surface of the skins. And the unique thing about sebaceous glands is that they give rise to our hair follicles. Within the sebaceous glands, your hair follicles usually grow as well. And what they do, what are their functions? Sebaceous glands actually stop the skin and the hair follicles from drying out. So they produce secretions, and the oily substance that they produce is known as sebum. But when you have acne, the sebaceous glands are too overactive and they produce far too much sebum. And as I'm talking, I'm looking at these comments, and Nabil is, what are you laughing at, Nabil? Wait until I speak to you later on. There's no need to laugh. It's true, every single word I've said about you. We've just got to keep positivity growing. We've got to keep together, and we've got to make sure that we block out the negative. Block out the negativity and negative people. We have no room for negative. We don't do negative within our world, do we? Yep. So if you can agree on that, it would be wonderful. And I do have another comment. Salam, do you read the Twitch chat? Yes, indeed we do. So it would be wonderful if you do want to send any questions through about acne. I would be more than happy to answer them. So please feel free to send a message onto the Twitch chat as well, and welcome as well. So we were talking about a little bit about the function of the sebaceous glands and that they produce sebum as well. Now, when your sebaceous glands produce too much sebum, they tend to form a little plug in the hair follicle. This can then cause inflammation, which can cause soreness, and it can give rise to a pimple, zit, or a spot of acne. All right. So the different types of spots that you get are papules, pustules, nodules, or cysts as well. Let's talk a little bit about how common it is. So most people with acne are aged between 12 to 25 years old, but there are older people who are also affected. And I'm sorry to break this news to you for the males, but boys are more affected than girls. And it's just the statistics and the way it is. And the reason behind that is because of the hormone testosterone as well. It tends to make your sebaceous glands overproductive in terms of producing sebum as well. So 8 in 10 teenagers will develop some form of acne. And often it is mild, depending on the type of acne you have. However, it's also estimated that 3 in 10 teenagers have severe acne that is bad enough to need treatment to prevent scarring of the face, because sometimes if you do get that much of inflammation, it can cause little pits on the skin, which is referred to as scarring, which makes the skin surface very uneven. So there are 6 main types of spot that are caused by acne, which I'm going to allude to. We do have a question here. So, can dermaplaning cause acne? This is by Sarah Jane Williamson. Thank you very much, Sarah, for asking that very interesting comment. And I think that that's a really good question. Now, dermaplaning, for those of you that don't know, involve a blade that is used to remove the hair from the surface of the face, usually in ladies as well, as the baby fluff type of hair. And dermaplaning can certainly cause, it puts you more at risk of acne actually on a number of levels. Now, it is a way of cleaning the skin. However, if the instruments that are used are not sterile, yes, that can cause the introduction of bacteria within the hair follicle that can give rise to acne. That's the first thing. So you have to make sure that whichever clinical practitioner you go to, or anybody that's offering this service, has squeaky clean instruments that are sterilized. Okay, so that's the first question that you need to ask, and how they sterilize them as well. The second thing is that dermaplaning is good because it does remove hair from the surface of the skin. However, what it can do is not to forget that it removes the top layer of cells from the skin, which can leave a more newer skin underneath that can be less mature. It can sometimes become sore or be more prone to soreness. Although I don't say don't undergo dermaplaning, But you have to make sure that you don't use many strong products of a chemical nature afterwards to cause any irritation. And when you go to a good practitioner that's offering dermaplaning, they will usually give you some aftercare advice that helps you prevent it as well. Make sure you're drinking plenty of water because you want circulation to continue within that area of your skin as well. So having plenty of water, making sure that you're not dehydrated, will ensure that your skin from within, through its circulation, flushes out all those toxins and bad bacteria too. So I hope that's answered your question. I have another question from Real Gaviant via Twitch. I have a skincare routine, but it makes my beard itchy. I just found out that I don't need to apply the products in my beard. I think that's a really important question, Real Gaviant. I think I've always, when you talk about hair care, and that includes beard on the face, I think circulation is very important. So you don't have to put as many products on the outside of your beard after you wash it or after you wash your hair, as opposed to what you should do in terms of pre-shampooing or pre-cleaning. And I always do suggest that it is important to make sure that you encourage circulation to the area. So head massages with oils are good. They have been tried and tested within generations of South Asian families as well. It would be good and beneficial to make sure that in the beard area as well, that at the roots, you are not just applying an oil, but massaging to promote circulation. And always make sure that the area of your beard is clean, because you are eating food on a daily basis, sometimes 3 times a day, and your beard is in close proximity to your mouth, which can harbour bacteria. And the migration to the beard can be a lot more easier for bacteria to enter into the sebaceous glands within the beard area as well. So if you are using products or anything for that matter that makes your beard itchy, then I would advise you to abstain from using them, okay? And there are plenty of products out there. A simple regimen is good for beard care as well. And I think this is a great question to ask. Nabil, does puberty play a massive role? Absolutely, Nabil, it does. So we've just touched on the fact that 8 in 10 teenagers will be affected by acne at some point in their lifetime. Those are the statistics. And the reason for that is, and boys are more affected than girls. Why is that? Because boys will shoot up at a time within their life, which is puberty time, and it's because of the overproduction of testosterone that makes your sebaceous glands overactive and can cause a lot of production with sebum. So that sebum can then block the pores and cause acne. But testosterone as a hormone has a role to play in producing sebum, and that can cause acne. I hope that has answered your questions. So we were talking a little bit about, and you keep these questions coming in because I'm telling you a little bit side to side about acne, how it can affect you and how it can affect the body as well. I really do want this program to emphasize on the treatments of acne, because for some people it makes their life a misery. And it's important to talk a little bit about how we can, for both men and women, how you can keep away, because hormones do play a part in how people break out. Okay, so I think it's incredibly important that we touch on that, so that you've got grades of acne. You'll have the types of acne, or the types of spots that you can have are blackheads. They're small, they're either black, they're yellowish, they're pinprick in nature, so very, very small. Whiteheads are similar in appearance to blackhead, roughly the same size, but they tend to be firmer and they don't empty when they're squeezed. Papules are small and red and may feel tender or sore. And pustules are similar to papules, but with a white tip that is caused by pus. Nodules are large, they're hard, they're often painful lumps beneath the skin. So those are the types that feel sore, and you put your finger on them and you think, ooh, you know. And there are some spots that a lot of people think you can see the white pus head, you want to squeeze whatever's there is out, but don't do that, because that could lead to further infection and inflammation. Then, of course, you've got the mother and father of all acne breakouts, which are cysts. And they are very large, pus-filled lumps that look similar to boils. They are the most severe type of acne with the greatest risk of permanent scarring to the face, which is the pitting that you get when you see there are some people that suffer from such severe acne that they actually get pitting of the skin. And they can actually make you cosmetically, people feel very conscious about how they look. And if it gives you any consolation, I used to suffer from cystic acne at some point as a young teenager. And it really did impact on me feeling very self-conscious. But with the right treatment, I was able to get away from actually having that. I made drastic changes to my diet. Of course, my parents were very much involved with making sure that I ate the right things, and that made eliminating crisps and chocolate and fizzy drinks, if anybody's listening, because we have to make sure that what we put inside our body is going to manifest on the outside. So that's very important as well. So Nabil, got to go for now. Catch up with you another time. Keep up the good work and don't be a stranger. We certainly won't be, but thank you so much for your wonderful questions, Nabil. And likewise, you keep up the good work that you do as well. Now, teenage acne. We have a regimen in order to treat teenagers with acne. It usually starts off with a gel or a cream that's simple, known as benzoyl peroxide. Benzoyl peroxide is a treatment that has either 5% or 10% of benzoyl peroxide in it. And what that tends to do is it literally shrinks the pimple. It can be quite aggressive. I usually advise my patients not to wear benzoyl peroxide where you have colored clothing, because one of the side effects is that it can bleach the clothing as well. So benzoyl peroxide is something that's used as a first step. So when we talk a little bit about acne, and I've already told you about what causes acne because of the overproduction of sebum. It causes inflammation, and then because it causes inflammation, because the sebum is now blocked due to an overproduction of it, it can then cause bacteria to infiltrate within the pore and cause an acne head, which is anywhere from a pimple to a cystic lesion of acne as well. Now, the bulge under the skin causes a spot or a cyst as well. So there are two things that are causing acne, if you think about it strategically: a clogged pore or a hair follicle. B, infection at the bottom of this blockage as well. So any doctor that sees you will try to treat where the source of your infection is, either by unblocking the pores or the hair follicles on the skin, or B, killing any infection that is more deep-seated that any treatment at the top won't be able to get to as well. So it's really important that we differentiate where your infection is coming from if you do suffer from a particular type of acne. There are other medical conditions that can cause acne, and I'm going to go over them very quickly before, in the second half of the show, we speak about treatments, because that's very important as well. So we have polycystic ovarian syndrome. It is characteristic that some women that have polycystic ovaries will cause an excess of the male hormone that I spoke about at the beginning of the show, called testosterone. And that can cause an overproduction of sebum, and it can also cause a thinning of scalp hair, excess hair growth, known as hirsutism, and also other problems. And being exposed to chemicals in the workplace, particularly chemicals called halogenated hydrocarbons, those can also cause acne too. So that's one thing that we need to be aware of. Then you have a condition that is known as rosacea. Now, rosacea affects around 1 in 10 people in the UK, and this can also lead to very small cysts and lumpy spots that actually look like acne. But with acne, rosacea also affects, similar to acne, your face, and your chest and your ears can also be affected as well. But rosacea doesn't really start in earlier ages. It's thought to start in middle age. And you can either have symptoms such as flushing affecting your face too. So we have about a minute before we go to the break. I'd like you to think a little bit about what I've said in the first half of the show so that we can go back. Also, to keep at the back of your mind when we'll be talking about treatments in the second half of the show is whether you are on any medication which can cause acne. And that could be contraceptions, steroids, anti-epileptic medication, and even lithium as well. So it's incredibly important that we think about all of these stages where I've spoken to you about how acne starts, how and what people it's in, and why you get what you get. So without further ado, I certainly won't go away anywhere. I don't want you to go anywhere. Here we are, coming to a break. Join me again, Dr. Shabina, after the break on the Body Health and Mind Show.
Stay tuned to Salam Radio after this short ad break.
Discover peace of mind with Islamic wills from W&P Legal and Mariam Khan. Expertly tailored to respect Islamic principles and UK law, ensuring your legacy is honoured. We offer tax-efficient wills, probate, lasting power of attorney and more. Trust us for a culturally sensitive estate plan. Your legacy, our priority. Call W&P Legal now on 01778 252 301.
Attention foodies! Discover a world of flavours at Pack Foods, the largest ethnic supermarket in Peterborough. Shop our vast selection of authentic ingredients from around the globe, including spices, marinated fish and meats, and exotic fruits at incredibly low prices. And the best part? We offer free parking. No more hunting for a spot. Come visit us today and explore the incredible range of flavours at Pack Foods, 232 Lincoln Road.
Bite into something wonderfully tasty at Big Mouth, 349 Lincoln Road in Peterborough. Eating in for takeaway or delivery, Big Mouth now have a delicious new menu full of all your favourites. Crispy fried chicken, juicy smashed burgers, finger-licking piri-piri chicken, handmade pizzas, quality doner meat and so much more. So visit the family-friendly Big Mouth restaurant for fantastically fresh food. Call 01733 201020 or visit getbigmouthonline.com.
Could you spare a few hours each month to provide support to people who are going through tough times? If so, Peterborough Samaritans are looking for volunteers who are empathetic and open-minded, and we'd love to hear from you. We run regular information sessions where you can find out more about what it means to volunteer for Samaritans. If you are at least 18 years of age and would like to know more, please email volunteer@peterboroughsamaritans.org.
Fancy the true taste of Middle Eastern Kurdish food? Asia Restaurant gives you the unique fusion of flavours from Turkey, Iraq, Syria and Iran. Eat in at 5 Fitzwilliam Street, Peterborough, PE1 2RU. Or order through Just Eat, Uber Eats or order through our website, asiarestaurant.co.uk. Call us on 01733 562 530. Asia Restaurant, the true taste of the Middle East.
Are you looking for a career where you can make a difference? At Cross Keys Homes, we work with our local communities to create opportunities that change lives. We're looking for enthusiastic, talented people to join our team, from apprenticeships to senior management positions. Cross Keys Homes can support your development while you enjoy great employee benefits. There are so many opportunities for you to shine. Apply to join the Cross Keys Homes team at crosskeyshomes.co.uk.
Peterborough's community radio station, Salam Radio, 106.2 FM.
Assalamu alaikum. This is your very own Dr Shabina Asad Qayyum for the Body Health and Mind Show on Salam Radio 106.2 FM. So we were having some great conversations before the break about acne, its causes, how it happens, and in which population of people that it has a sort of an incidence, as it were. So we've had some great interaction already. We've had quite a few messages come over Twitch, and we've also had some other comments on the Facebook Live, which I think is quite an effective portal, isn't it, for people to watch the show and also to ask questions. So I'd love for you to speak to me. Come on, it's a bank holiday weekend. Your Salam Radio staff have come into the studio. Pick up those phones and come and have a chat with us. Call us on 01733 602 133, or you can text us on 07411191062. And like you're already doing, commenting on the live stream on Facebook, YouTube, Twitter or Twitch. And I'd like to welcome, before I go on to talking a little bit more about acne, David Garner, who is our comedy star of the Body Health and Mind Show. And his jokes are amazing. So I'm going to start off the second half by reading out his joke. And David shares with us, don't forget, it's the AGM of the Weak Bladder Association tonight. If you can't make it, just give us a tinkle. Well done, David. Thank you so much for that one. Thanks for making us laugh, and thanks for tickling our insides as well with your wonderful, wonderful jokes and making us just smile. More power to you, David. Thank you. So before the break, we spoke about the causes of acne, that there were hormonal factors involved, that it happens more in boys as compared to girls in teenage years, although there are certain medical conditions in which people can get acne, such as polycystic ovarian syndrome, if they're on certain medications like steroids or anti-epileptic medications, if they're on lithium, for example. But what I'm going to do is talk a little bit more now about prevention. So it's very important that we speak about prevention, because if we don't speak about prevention, then we can't really talk about cure. And I've always, I think, been of the opinion, I'm not the typical type of doctor that likes popping pills for everything, as many of my colleagues don't either. But I always think that prevention is better than cure. That's something that I have in terms of ethos as well. And we have Mohammed Abdullah Rizwan. Nice show. Thank you very much, Abdullah. Thank you for joining us as well. It's wonderful to have your company. So let's talk a little bit about how to get rid of acne in the first place. So you found yourself with a variant of a type of acne, whether that be pimples, zits, or the more severe cystic type of acne. First things first, try not to over clean your skin. Do remember that acne doesn't take place as a result of you having dirty or filthy skin, okay? You are not dirty. Over cleaning it could cause more opening of the pores, scratching of the skin surface, which could facilitate the entry of bacteria and make your acne worse. So try not to over clean and strip your skin of the normal balance of sebum that is already being produced. That's the first thing. And the second thing I'd like to say to you is that you have to maintain a certain pH level within your skin as well. So if you use over astringent, alkaline-based cleansers or things to wash on your face, it will make acne worse. And that is why you use a non-alkaline synthetic detergent cleansing product twice a day. And I advocate for something like salicylic acid. So anything with salicylic acid in it will help with getting rid of your acne. And if there's anybody that I'm going to give an example of, it's my own son, Abdullah, who, he won't mind me saying this, has suffered from the odd acne. He's a teenager. He's growing up. The statistics have shown that boys suffer from acne more than girls do. And I get him a salicylic acid cleanser. Anyone, over the counter, you can get it from your local chemist or local stores as well. Pick it up, use it twice a day, but make sure you do use it as well. And what he tends to do is he foams it up, he applies it on his face, keeps it on for a minute, and he washes it off. And that is fine. Also, avoid oil-based skincare products. So makeup, sunscreen. I think it's really important to understand that when you read these products, make sure that they are labeled clearly as being non-comedogenic. Because if they are comedogenic, that means that they are blocking the pores and give rise to infection, inflammation, blocking of those pores, which can then give rise to pimples or acne as well. And Jason McNally has written a comment, preventative medicine is the way forward. Absolutely right, Jason. And who knows more than you, our honey king who produces his own honey, which is great because we all know that honey is very good for coughs and colds. And Jason here produces his own honey. So thank you for that comment. Now, always remove your makeup if you apply it at the end of the day, or even if you're male and you've put on your sunscreen or you've used whatever products you need to use, make sure that you wash your face at the end of the day. It is incredibly important. If you don't use anything and you've come back after a hard day's work, or you've been at school or college or university and you come home, please don't go to bed without washing your face, because invariably what you do is you transfer any grime or dirt that your skin has accumulated onto your pillow, and that can cause a harboring of or production of bacteria that can make your skin again break out. So that's important too. Avoid picking or pinching or scratching your spots, as this can increase the risk of not only having an infection superimposed upon the infection that you've already got, but it can also cause scarring on your face and cause these little pits on the face that people can sometimes find very problematic as well. And this is one tip that I cannot emphasize enough on, and that is maintaining a healthy diet. So when I'm usually in a room and I'm speaking to young people and I'm talking about their skin, I ask them all to raise their hands. How many of you actually have 5 portions of fruit and vegetables every single day? And the reality is that teenagers, the proportion of teenagers that are meticulous about eating fruit and vegetables on a daily basis is quite smaller than we realize. And we only get to think a little bit about our health and how healthy we are when something happens to us, or something starts aching, or we've been diagnosed with diabetes or a heart condition. And that's when it occurs to us, well, actually, we should have looked after our health. Like I said, and I'm going to repeat this, prevention is better than cure. So having your 5 portions of fruit and vegetables on a daily basis is incredibly important. Please ditch those fizzy drinks for water and make sure that you're chugging at least 8 glasses of water on a daily basis. If not, fruit juice is also good. Make sure that it doesn't have too much, or it's not from a fruit that has too much sugar content in it as well. I think that's important. There are fruits that are rich in antioxidants that are great for the skin. Fruits that are rich in vitamin E are great for the skin. Vitamin E is a very powerful antioxidant, and anything that you put within you will make your skin glow as well. And it's incredibly important that we have as a mainstay of treatment a healthy diet, which also means eliminating sugary-based foods such as donuts, biscuits, cakes, chocolate, I'm sorry to have to say, sweets, jelly babies, gummies. Anything with sugar in it is just not good for the skin. Sugar in itself isn't good for your health. It's not good for your teeth. It's not good for the skin. So cut all of that out if suddenly you have found that you are coming out with acne and spots as well. And apart from that, also, it's important to make sure that you are upping and continuing your intake of fluid on a daily basis. And I usually say to my patients, look, here you are, you've presented with this condition that's acne. There are some things that I'm going to do for you. There are other things that you will have to do for yourself. And when I do give out treatment, The other thing that you can do as patients is to keep consistent on that treatment. Not that you've been given something, you intend to put it on, and the very next day you're expecting results. That is not going to happen. Like I said at the beginning of the show, it takes about a month to see a difference. So it's very important. And I know it really does affect you in terms of your confidence. But if you cannot have persistence using your treatments consistently, then chances are that the spots on your face will become resistant to treatment and they will be more difficult to manage, not only by you, but also by your doctor. So please make sure that whatever treatment that you are given, you take it consistently as well. Before I talk about specific treatments, the other thing is that it's important not to wear makeup every single day. And there are those types of acne that can get worse with makeup as well, simply because of the fact that makeup can block the pores, causing the spots. So putting a lot of makeup on, like foundation, can make acne worse. A lot of girls and young women try to cover up their acne, and that's absolutely fine. Sometimes it is needed that you need to cover up the acne because of the psychological effects and the cosmetic effects and the look that acne can sometimes give an individual, which impacts on their self-confidence. Self-confidence is incredibly important. However, it can irritate the skin. It's very important that people that are watching this or listening to this know that. Try to have some makeup-free days to allow your skin to breathe. If not, at least a part of the morning, let your skin breathe. And if you do need to use makeup, try to use one with a pH that's closer to the skin. So what I usually do is I usually advise patients that there are some foundations that have salicylic acid within it as well that can be a preventative for those individuals that use foundation and also have problems with acne. Also, mineral makeup is thought not to be comedogenic. Always check whether the ingredients on the foundation that you're using is comedogenic. Likewise, a lot of young people like to use powder. So a mineral makeup powder is much better, much lighter. It will sit on the surface of the skin and not block your pores. So make sure that you are investing in something. Some of these products can be expensive, but it's worthwhile investing in something that's a little bit more expensive, because if you invest in something that's cheap, you're compromising your skin and skin barrier. So it's very important that you use something that is reasonable, but also you're doing the right thing for your skin. Now, we have a question. Actually, no, it's a comment from Jason McNally. I do drink at least 3 litres of water-based juice a day, directed by my medical officer in the army. I still live by it today. That's wonderful, Jason. That's great that you're sharing with us, and thank you for doing so, which is not carbonated. Again, not fizzy. So water-based juice, which is great. And actually, sometimes you can have the sugars within, the fructose within, if you're not diabetic, that is, within those juices can actually give you energy throughout the day as well. Smoothies, again, another great way to try and get your 5 a day within you. And smoothies aren't difficult to make. Honestly, they're not. Even if you use frozen fruit, it is worth making as well. The other tips that I'm going to give you is try to avoid touching your skin or sitting with your hands over your cheeks or your chin, because your hands are parts of your body that touch different surfaces, however much you wash them, and they are the perfect vector to transmit infection onto your skin and onto your face as well. But make sure that you wash your hands before you apply any medication to your face as well. And keep your skin cool, because sweating heavily or humid conditions can actually worsen acne as well. So doing regular work within the kitchen with extra sweat possibly contributes to blocking pores too. And although this can be unavoidable in very many circumstances, always make sure that you're splashing your face afterwards and allow your face to air dry, because sometimes what can happen is that your towel can also, very much like your pillow, be a vector for infection as well. Wear loose clothing for those that tend to suffer from acne on the chest and on the back, because spots can also develop under tight clothing, under headbands, under tight collars, under underwear as well. It's very important that your undergarments aren't rubbing against your body for long periods of time, because that can also lead to acne. And there's a really good resource from the National Institute of Clinical Excellence that gives us a step-by-step approach on how to treat acne. So it's important that we look at the dietary aspect, and this was all about my whole prevention thing, but there will be those segment of people that also take medication that can make acne worse. So some contraceptive pills can make acne worse, whereas other pills can actually make it better. Progesterone-only contraceptives, so the mini pill, can make acne worse because they are progesterone-based. Progesterone-based is known to cause a depletion of estrogen as well. So estrogen is a friendlier hormone, and there are some combined oral contraceptive pills with estrogen which are actually used for acne and can balance that sebum production out as well. Anabolic steroids, some bodybuilders take them, and they are taken illegally actually. So it should be noted that if bodybuilders start all of a sudden developing acne and their muscles are growing big, it could be that they're taking anabolic steroids. So that's one thing to look out for as well. But alongside that, there are some myths and there are some wrongly held beliefs about acne. They say that acne is caused always with poor hygiene. In fact, we do know that excessive washing can make it worse. That doesn't mean, however, that you stop washing altogether, because poor hygiene can also cause a vector for infection towards the skin that can cause acne too. They say that stress causes acne. In fact, it's stress that leads to poor dietary habits that cause the acne, not the stress itself. So that's another thing to be mindful of. Acne is not just a simple skin infection. Like we said, it's a complex mesh of interchanging hormones, overproduction of sebum, overgrowth of normally actually harmless bacteria, and then can cause inflammation. You can't catch acne, and it's not passed on through touching somebody that has acne as well. There is no evidence as well to say, as another myth, that sunbathing or sunbeds can help clear acne either. And some people believe that acne cannot be helped by medical treatment. Well, they're actually wrong. Treatments usually work well, like I've said at the beginning of the show, when they're used correctly. And the most common mistake is to give up too quickly because you're asking or expecting results too quickly. And skincare, again, a salicylic acid for your skincare is very good. Don't wash more than normal. Don't scrub your skin more than normal as well. Try to avoid oil-based moisturizers if you're using skincare products. And blackheads are actually caused because of an accumulation of detergents, soap, and also skin scale and debris within the skin. It's not as a result of dirt, but blackheads can be removed. And there is some notion that pigment known as melanin is also within those pores. So removing those blackheads can be effective, but you've got to make sure that you're doing so under a sterile environment as well. I'm going to talk a little bit about topical treatments, and I know we always run out of time, but I've got the last 6 minutes of the show, so I think it would be great. And if you've got any questions so far and anything that you've heard, please do get back to me. So I did speak about benzoyl peroxide in the beginning. It's very common. It's usually the first line treatment that's given for anybody that's got acne as well. And you can find it without a prescription. You can get 2.5%, 4%, 5%, 10% strength. It works best if you wash your skin 20 to 30 minutes before use. And like I said, it can bleach your hair, it can bleach your bed linen, it can bleach your clothes as well. So be very careful. Sometimes the side effects of that is that it can cause a mild skin irritation. If your skin does become irritated with benzoyl peroxide, please stop using it until your irritation goes. Then try it again with a lower strength. So if you go in straight at 10%, the likelihood is that you are going to get skin irritation. So go in with a 2.5%. If that's good for you and clearing your spots, wonderful, stay at it. But if you're finding that it causes irritation, then stay off it. And this is for the teenagers, actually, because I think that this is important that we start with something basic and not too strong for their skin as well. Try to use a water-based preparation of benzoyl peroxide rather than an alcohol-based one, because we've spoken about alkaline products worsening acne as well. You can apply it once daily at first and increase the length of time left on the skin when you get used to it. Now, coming on to something known as retinoids. They're good at unplugging blocked pores. So you've got quite a few. You've got retinol, you've got adapalene, you've got tretinoin and isotretinoin, which come in various brand names. They've got an effect on reducing inflammation for those people that have acne as well. And you need a prescription mostly for all retinol products, apart from retinol, which is different to isotretinoin and tretinoin, which is prescription based as well. You can get an initial skin redness with retinoid products. They initially may cause a purge because what they're doing is they're facilitating an overturning of the skin renewal process. But this tends to settle over time, which is why it's very important that you use it 2 nights a week for your first 2 weeks. Then you can use it at a gap of every 2 days. And slowly but surely, it is better to use it every second day with the free days that you have using a vitamin C preparation. Remember, retinol and vitamin C don't go together. Vitamin C is wonderful because it is an antioxidant and it is great for the skin as well. And if any of you have any questions, you can inbox Salam Radio and I'd be happy to answer your questions as well. Do remember using sun protection is very, very important because the harmful UV rays from the sun can actually deplete collagen. And yes, you do put yourself at risk of burning, which can cause further inflammation, which can place you at further risk of acne as well. So your retinols are very important. I'm very mindful of the time. That is why I am going through very briefly, but make sure that you do listen to everything that I am advising as well. You should not use retinols if you're planning to get pregnant or you are pregnant as well. But discuss contraception with your skin specialist or your GP if you are going on retinol, in case if you are active from that point of view, you do fall pregnant, because you would need to come off it a couple of months beforehand as well. So there are antibiotic preparations too. These are great for treating acne on the back and on the face. But if you do have a large amount of acne on the back that is large, that is cystic, it would probably be better to have a course of antibiotics by mouth, because that would be a lot more effective at systemically minimizing and getting rid of the bacteria that is clogging up those pores, causing the inflammation and causing the acne. But although antibiotics are very useful at treating inflamed acne, but for blackheads and whiteheads, they're not that great. So it probably is useful for you to use a salicylic acid base face wash or even a topical antibiotic cream too. But salicylic acid or benzoyl peroxide are just okay for the smaller whiteheads and the blackheads as well. Azelaic acid is another one which is very good, and it's an alternative to benzoyl peroxide, especially for those people or those patients that have a lot of irritation from benzoyl peroxide. And how it basically works is it unclogs the blocked pores. So in retinoids, they're good at clearing blackheads and whiteheads, and it also has some role in reducing inflamed acne too. However, not as much as antibiotics or benzoyl peroxide, but it can cause less irritation than benzoyl peroxide, and you can buy azelaic acid in the shops. So combinations, benzoyl peroxide and antibiotic are used. Benzoyl peroxide, adapalene, again, retinoid is used. They may work better than either ingredient alone. And before we go, I'm going to point you to light therapy. Light therapy, there is some scientific proof, but blue light for mild acne is very good. And you can buy these via an LED mask. You can get them from Amazon or anywhere online. So it was wonderful to be back. I know it was a lot of information, but feel free to ping me some questions and also have a look at my TikTok channel as well under Doc Shab, which is Dr_Shabina on TikTok. But until then, be wonderful to join you again on the next Body Health and Mind show for Salam Radio 106.2 FM. Assalamu alaikum.
Stay tuned.